Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss about what are the pressure ulcers and how pressure wound injury can be prevented. Hello Dr. Archana. Welcome to our podcast for patients, caregivers and healthcare professionals at Medica Talks. Doctor, can you tell us how pressure ulcers are caused?
Pressure ulcers are also called as bed sores or pressure sores. They can form when your skin and soft tissue press against a harder surface, such as a chair or a bed, for a prolonged time. This pressure reduces blood supply to the area. Lack of blood supply can cause the skin tissue in this area to become damaged or die. When this happens, a pressure ulcers may be formed. You also have a risk of developing pressure ulcers if you have spent most of your day in a bed or a chair with minimal movement, or overweight or underweight, are not able to control your bowel or bladder, have decreased feeling in an area of your body, or if you have spent lot of time in one position.
What is pressure injury?
Pressure injury is also called as bed sores, pressure ulcers, pressure sores or decubitus ulcer. In an area of injured skin, a pressure injury, when force is applied on the surface of the skin, this force can be constant pressure on an area of skin or dragging forces between the skin and another surface. These injuries usually happen over a bony part of the body, such as hips, heels, tailbones, elbow, heads, and ankle. A pressure injury can become life-threatening if it advances to a deep wound or becomes infected.
What are the stages of a pressure injury?
There are 4 stages that describes the severity of the wound. These stage includes Stage 1. In this stage, the discoloration of skin is seen. The skin appears red in those with lighter skin tone and blue or purple in those with darker skin tones. The skin does not blanch when pressed with a finger. In stage 2, the stage involves superficial damage of the skin. The top layer of the skin is lost. It may also look like a blister. In this stage, the top layer of the skin can self-repair itself. Stage 3. In this stage is a deeper wound. The wound is open, extending to the fatty layer of the skin through muscles and bones are not showing. Stage 4. This stage is the most severe stage. The wound extends down to the bone. The muscle and the bone are prone to infection, which can be life-threatening.
Who is at risk to develop pressure injury?
People with limited mobility are people who cannot move at all. Those in wheelchairs or bedridden are at particular risk and need to be moved or turned regularly. Those with prosthetic or artificial limb, if the device does not fit properly, the skin can be irritated and pressure injury can develop. People with loss of sensation, they are at a risk because they may not feel the pressure being applied to the skin. As a result, they may not move, which would worsen the damage. Those with malnutrition. Wound healing is slowed when nutritional needs are not met. The elderly. As people's age, the skin naturally becomes thinner and more easily gets damaged.
What are the causes of pressure injury?
Pressure injuries are caused when a force is applied to the skin, causing damage to the tissue. Several types of force are included. Pressure force. Constant pressure on the skin results from remaining in the same position for a prolonged period of time. Shear pressure. Shear damage or dragging forces can occur when the head of the bed is raised and the body slides down. The skin sticks to the sheet, but internal structures are damaged. Moisture. Fluid such as sweat, urine, fecal matter that remains on the skin can cause the skin to become overly wet, which increases the risk for pressure injury development.
What are the symptoms for pressure injury?
The symptoms of pressure injuries can include change in skin color, non-blanchable redness in lighter skin tone, and non-blanchable blue or purple skin in darker skin tone. Skin swelling, pain or tenderness. Skin that feels cool or warm to touch than other areas. Skin loss, exposing the deeper layer of the skin. Pus-like drainage from an open area of the skin.
So, how are pressure injuries diagnosed?
Pressure injuries are diagnosed by your healthcare provider during physical examination.
How can pressure injuries be treated?
Pressure injuries can be treated in many ways depending on their stages. Once the stage and the severity of the wound is determined, it must be cleaned, usually with saline solution. After the wound is clean, it needs to be kept clean, moist and covered with an appropriate bandage. There are several different types of bandages your doctor must have used. These include water-based gel with a dry dressing, foam dressing, hydrocolloid dressing and alginate dressing. Sometimes debridement is needed. This is a process of ridding the wound of dead tissues. Debridement is an important part of healing process. It changes the wound from a long-lasting one to the short-term wound. There are several types of debridement. These methods include ultrasound, using sound waves to remove the dead tissues. Irrigation, using fluids to wash away the dead tissues. Laser, using focused light beam to remove the dead tissues. Biosurgery, using maggots to eliminate bacteria from the wound. Surgery, using surgery to remove the dead tissue, close the wound. Topical, medical grade honey and enzyme ointments.
How can pressure injuries be prevented?
The development of pressure injury can be prevented through careful observation in the skin and frequent repositioning in those who cannot turn themselves. Tips to prevent pressure injury includes keeping the skin clean and clear of bodily fluids, moving and repositioning of the body frequently to avoid constant pressure on the bony parts of the body, using foam wedges, pillows to help relieve pressure on bony parts of the body when turned in bed, maintaining a healthy diet to avoid malnutrition and assist in wound healing. If the wound becomes infected and the infection can spread to other parts of the body, several conditions that may occur if the infection spreads. Cellulitis, it is an infection of skin. Osteomyelitis, it is an infection of bone. Bacteremia is an infection of blood. Meningitis is an infection of brain and spinal cord. Endocarditis is an infection of heart.
So, Dr. Archana, what message would you like to give to our listeners?
If you suspect you have a pressure injury, speak with your doctor. A pressure injury is easier to heal if it is discovered in an early stage. It is important to prevent a wound from becoming infected. Healing is delayed in an infected wound, and the infection would cause problem in other areas of the body too.
Thank you, Doctor, for being a part of Medica Talks and sharing your insights. We are hopeful that this informative talk has enlightened our listeners on how pressure injury can be prevented if treated at the right time.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to you all kinds of healthcare industry news, views and opinions from around the world.